today with Nurse Corlita Joseph. Nurse Joseph, you don't need an introduction, and we thank you for sitting down with us. We've been really interested in this topic of HPV. It's something that has been in the news a lot lately. Here at AUA, we've been getting a lot of comments about it. We've had discussions with many of our local physicians here in Antigua and Barbuda as well. But I wanted to get your take on, if you, from your perspective, from your background and what you're teaching the community, can you explain to us what HPV is and its effects here, and then we can get into some more depth as far as treatment options and so forth.
Well, first, to begin, thank you for speaking with me.
No problem.
And yes, I know that for the HPV is the human papilloma virus that affects both males and females. And it is seen even mostly in the women because that is what will also cause the cervical cancer. And you know, a lot of our people are dying from that particular cancer, cervical cancer. And so here in Antigua, we are trying to bring an awareness as to what's happening.
You said many persons are dying of it. Is it to say then it's being ignored, not much emphasis has been put on the cervical cancer that's causing these deaths? Are people going untreated? Where do you see it starting?
I believe that some people are going untreated, but it's not that it is ignored. Because a few years ago, that's before I became superintendent and expanded program of immunization manager, we had a program where we were doing a lot of screening for this virus.
Okay.
And the program was good, but as any other program that sometimes becomes finance becomes a challenge.
Understood.
It goes down. And so we were unable to get some of the supplies that we needed to continue the program at the level at which we really want it to be. And so it went down a little bit. We still do screening, and I do think too that sometimes the amount of tests that need to be done, samples that we have, it's overwhelming for the one hospital or the lab or the cytotechnologist that is there.
Explain to us, you say the screening. What is the screening process that our viewers may be interested in knowing about?
Yes, the screening is taken at pap smear. Okay. And I believe that the Antiguan public knows about the pap smear. They've heard about it a lot. They've gone to the clinics. The clinics were the ones who offered, and it was free of cost.
Do you think everyone knows what the pap smear is for? They hear the word pap smear, but why?
Some. I don't think it's everyone that knows. But some people do know the reason why we would tell them. Because in the clinics, the nurses would say, okay, your pap smear is due, or you should have a pap smear after having the baby and so on. And they would say, this is the reason why.
Is there a fear?
It could be. I mean...
It's invasive and...
Right.
Personal.
Personal and, you know, things like that. So some people may have a fear. Some don't, but you can understand if you are having a good relationship with your nurses or your healthcare providers. They would give you the information and they would allay your fears.
Right.
You understand? But still, you can't say you reach everybody.
Understood.
You understand?
And which is why it's important that we continue the education process.
That's right.
And
I'm bringing awareness.
And bring the awareness. I'm going to take you off track just a little bit because in a recent discussion we had with regards to HIV, we were talking about education and how so many things seem to be a bit taboo when it comes to sex, private areas. People don't want to call the words. They don't want to. How do we get above that? How do we get above the fear, beyond the fear of these tests in order to, that ultimately are going to protect we ourselves, our children. As a nurse, and you're senior to this, what are some of the techniques that you think can be used to help allay the fears of
I'm thinking health education and health promotion all the way. I think if we have more health education in our settings, whether it's our clinics, our churches, on the wayside, we go where they are, where the people line, as we call it, in Antigua, and some of the clubs, if we get into them, if we can get into them.
You think they'll let you in?
Well, we'll have to try everything. You know, sometimes
Okay.
you have to try some things that people think would not work in order for it to work. And so if we start with like the churches, faith-based organizations, in the alleys, one-on-one, and so on, just like when you witness for churches, and you sometimes witness on a one-on-one basis, sometimes you might have to do that. But I believe that it's health education, health promotion, that is going to get us off the ground with that taboo situation.
That's an interesting point. And because it starts with the young people also, both the health education and health promotion, going back to HPV, how do we begin to educate our young people? Because when you think of cancers, if we speak to many of our young people, I think they think, oh, I'm too young to get cancer.
So what we would have to do is to let them know that this virus is spread by sexual activity, having sexual intercourse, and especially if you start at an early age. We have to let them know, just like when we talk about HIV, that the HPV is just as real, and it will kill them. They will get it. And if we start it off, we should have these things maybe in the schools as well. I know that some educators, they would want to think that, you know, they want these things being said to their children so early. But the thing about it is that the children who are not molested, are doing it freely. And so they need to know early what can happen to them, both the males and the females. We could do it in the schools as well. And so we would be able to spread the message more. Snowballing, you can't underestimate that. Because as you say it to some children here, a little group of children, they're able to say it. And they just keep going and going. Some of them parents will hear about it, because some things the parents only know about from what is being taught to the children or said to them someplace. And so all of the ways in which we can imagine or conjecture, we need to make sure that we use them up.
We have to take a quick break. However, when we come back, I'd like you to tell us at what age some of our youth are beginning to engage in sexual activity. Stay with us, we'll be right back. If you're just joining us, we're here with Nurse Corlita Joseph, and we're talking about HPV. But before our break, we were talking about sexuality as well, and especially as it pertains to the youth here at Antigua and Barbuda. Now, you mentioned that our young people are beginning to engage in sexual activities early. Could you tell us at what age it's being thought that they're beginning to have sex?
Yes, we found out that you have our young people engaging in sexual activity as early as 9, and sometimes even before that.
This is not just because of possible molestation or sexual abuse or anything like this. This is they themselves. They themselves.
Some of them are that matured at that age, and so you find that they sneak away.
Okay.
Right, with some little friend or something, and you know, may not even know what danger they're putting themselves in, but it happens.
And this means something that they've either been exposed to, whether it be, we were talking during the break about technology and the effects that technology is having. It has its good points, but then...
But it has its negative points as well. And when we think about the technology, sometimes we don't know what our children are looking at, all right? Sometimes the television is on and they flip in, and sometimes you think they're watching a good program, but then for the children, but then when you catch yourself, they are more interested in something else that they saw on another channel. And once your back is turned, that's it. Think about the computers and the type of phones that we buy for them as well. And this is their little personal phone. They know how to put all of the little things in place to get you off their track. And so you find that they would use that time in the nights or in the day or whatever, and they look at certain aspects.
That's interesting, because now we group or clump all of this back together in that here it is, we have this virus, the HPV, that's affecting, that has these effects later in life.
That's right.
But starting at a very young age. What's being done to, we talk about health education and health promotion, understand that, but let's say medicinally or medically, what can be done to now help young people who may be engaging in sexual activity early on to allay the HPV and or cervical cancer later on in life?
I think we just have to talk abstinence for these young people as early as we can. Ask them to, you know, not have many partners, sexual partners. We can sort of probably show them how the virus works, right? By showing them the graphics. It can happen. Organize them in groups and show them the graphics, let them know how it works. Also, we can let them realize that once you get this and you have like the invasive carcinoma, then it means that you might have to have some procedures done. It's not easy. We have to let them know while it is early.
There's been talk about vaccinations and so forth to help. Can you elaborate on this?
Well, that's the other point there, that you can help them, and that is for us to give them the HPV vaccine, right? There are different strains, as we know, but there is this one they call Gardasil, which is more widely used, it seems like, in the other countries that have already introduced the HPV vaccine. And in this light, we would like the young people as well to know, if they're listening, that this vaccine is coming on stream, and we would like them to be even advocates of the vaccine so that they can tell others. Once we have educated them and we have also have the health promotions and they see and understand, we are expecting them to help us to put the word out there how important it is for them as young girls and young boys to get that vaccine.
But now you raise a point of potential controversy and or contention, right? Because now we're saying that our young ones, or the youth, are beginning to engage in sexual activity early on, but now we're saying, okay, well, let's give you a vaccine so that you won't have this problem. So could it then be argued that you're encouraging the youth to go ahead and start having sex early on?
That is why we would have to be very tactful as we bring an awareness and as we educate, right? Because it is not a license for you to, we're not saying, since we give you the vaccine, then you can go ahead and be promiscuous, you can do what you feel. We still have to think about the morals, the values that we're teaching our young people. And so we wouldn't want you to, because you have had the vaccine, that you think it's okay, I can do as I please here, there, and everywhere, because I'm not going to get this particular thing. Nothing is going to happen to me. We still want you to look at what you've been taught growing up before getting into, your body is not ready for all of this activity.
No.
And so there's a lot more stress than even getting the virus.
Because we talk about this particular virus,
Yeah.
that's not to mention that there are not other things
That's right.
that are out there. You also mentioned strains. Are we saying that there are different strains to the virus as well?
Yes, that is what we're saying, and that is why the one that I know about as they will produce the vaccine is the Gardasil.
Okay.
Right? And you know, sometimes you see some of the pap smear results come back with Gardnerella, Gardasil, and stuff like that.
Okay.
Right? So they're different strains.
Good. Now, we've been talking about youth, in particular the females. Is it to be ignored or then said that this is only for females?
Of course not. Of course not, because you would see men with the warts, right? And you would also see the women. So it's on both sides. And that is why if we're going to introduce a vaccine, we would really like to give it to both the females and the males.
Now,
We really like to do that.
I'm just playing devil's advocate here. When you say you see the gentleman with the warts, please be specific. Where or what would they see?
Genital warts. You would
Okay.
see it on the penis. You see the young lady with it on the vaginal area, and so you would understand that it is affecting both males and females. So if you see yourself as a young male with the warts and so on, you've been fooling around, you need to go see, your healthcare provider so that they can help you.
Can assist. And the vaccine itself, is the vaccine then to be introduced only to the young females of Antigua and Barbuda?
No, we're hoping, even if we introduce it to the young females first, right? We are hoping that we will be able to equally introduce it to the males as well. Because, if you have the males running around with the warts, they're spreading.
Right.
You're protecting the females so that they do not have the virus early or any time in their lifetime. And so you definitely need to make sure that you are getting rid of that particular virus.
So although we're saying that they're starting at a young age, what is the youngest age in which the vaccine could actually be administered?
Well, here in Antigua and Barbuda, we've been talking about introducing it at the age of 9. Between 9 to 11, we can start introducing right there.
And that's based on the fact that research is showing that the youth are
That's
beginning
right.
to start
Yes,
having
at
sex
that
at
age,
9.
Yeah.
Okay.
As well as, I remember being at the EPI meeting, which is the Expanded Program Immunization meeting, and they spoke about introducing it at that early age as well. PAHO introducing it at that early age as well, because it is like maybe the median age
Okay.
for the young people.
I'm glad you threw in those regional groups. Antigua is generally clumped amongst Latin America and the Caribbean
Yes.
as it pertains to research.
Yeah.
Is it the same within the neighborhood, if you would?
It's more likely. Yeah, more than likely it is the same.
And so
Yeah,
they're
'cause
looking
most-
to take a similar
And
path.
some of the countries, as I've said, has introduced the HPV vaccine already.
Really?
Yeah.
Would you be able to identify?
I think I understand it's in Guyana
Okay.
and Jamaica. Those are the areas that I can remember. And I remember that Dominica and so on were talking about the introduction of that. As to whether or not they have gone on to introduce, I'm not quite sure.
Okay. We're going to take another break. Stay with us. Don't go. We'll finalize on this topic right after this. We'll be right back. If you're just joining us, we've been talking with Nurse Corlita Joseph about HPV, the human papillomavirus. And my final round of questions to you, Nurse Joseph, has to pertain to some of the challenges that you think we're going to face, or that the nation is going to face in going forward. We spoke about the need for the health education, as well as promoting abstinence with some of the younger ones, as well as the vaccine. But going forward, what are some of the challenges you envision?
Well, I can see off the bat, one, we're going to have a financial problem.
Okay.
All right? Because
In
as it's
vaccine or?
understood, the vaccines are expensive. So that's one of the challenges. We will have to know how we are going to maintain if we introduce. The other thing I'm seeing is the uptake. With the people, after educating them and so on, would be willing, after we have bought the vaccines, would they be willing to come and get the vaccines so that we don't have wastage? Because remember, once you buy and you have to waste, that's money.
Exactly.
All right, in doses or however you see it. The other thing is that we have to, one of the things that I believe would be a big challenge as well is how the public would want to embrace the fact that we're giving this particular vaccine. If they're not for it, we are going to have a problem. I'm also thinking the staff in the centers, the health centers, and wherever we're going to be giving the vaccines from. The staff themselves have to be a part of the idea of giving the vaccines. They have to make sure that they sell the vaccines, and as I said, not in money, but in how they see the vaccines getting out there to the people. And so they themselves have to be a part of all that we're doing. The Ministry of Health has to be very supportive of the initiative,
Okay.
and all of the other stakeholders should also be a part of it.
You use the word stakeholders. Do you think the relevant stakeholders are healthcare providers or health savvy enough to make the decision as to whether or not this initiative needs to go forward with the urgency in which it should?
I would want to believe that we have a few persons and a few healthcare providers who are very willing to make sure that this goes forward. We have, for example, as I said, we have at our immunization meeting conference, we had invited one of the pediatricians to talk to the staff at the conference as it relates to the HPV vaccine and the virus and everything and so on, which she came by and she did an excellent job.
Excellent.
She, I think, is already giving that particular vaccine.
Okay.
I am not sure if it's on a wide range or just selected few, and it must be very expensive.
You're right.
At that point.
And the fact is, and do you think the fact that the healthcare providers that are out there may themselves have their own selective issues as to whether or not they are for and or against the vaccine? Do you think there will be a level of controversy? I won't say infighting, but just controversy as far as the level of support?
There might be, because with everything that you try to do, every introduction of some new idea, there are persons, unless they can buy into it and see the benefits for themselves, which means they would have to internalize it and then realize that how much they can help to spread it. If they are not, if they're not au fait with it, then we're going to have that as a challenge as well. Mm-hmm. So we would have to definitely try and see. As we educate the public, we are thinking that the healthcare providers are a part of the public, and they too have to be educated as it relates to this.
Of course. And as we wrap up here, can you tell us, and or the viewers specifically, we've covered a number of topics over the last few minutes or so, but what are the ultimate benefits that we're looking to receive from this?
Well, I'm thinking that, for one, our young people would be protected as the first thing. Mm-hmm. Two, that their lives would be spared. They would probably live longer and not die from the HPV vaccine, virus, the cancer. All right, I'm thinking that, and I'm also thinking that our community would be safe, free from this particular virus, because we do have that intention to eliminate or eradicate certain viruses from around these parts.
That would be a wonderful accomplishment. And we would like to support you in that in the best way possible. And hopefully by using this platform as well in order to educate persons of here in Antigua and Barbuda, as well as viewers on other islands that may be viewing the program, that they too may be able to benefit.
And one thing I should say is that AUA, I want to thank AUA for the many supports that is being given to the Ministry of Health.
It is indeed our pleasure.
I'm hoping that you will be on board with this particular initiative.
Most definitely, most definitely. Thank you for spending some time with us today on Healthy Perspectives. As we always say, hopefully this will not be your last visit, and we look forward to having you back again.
All right.
All right?
Thank you.
Thank you. We'll take our final break and be right back with you. Stay tuned. We hope you've benefited from our program today. As always, if you have any issues or concerns, especially as it pertains to HPV, as our discussion was today, please address them with your healthcare provider. Be well, Antigua and Barbuda. We thank you for spending some time with us and for allowing us to share healthy perspectives with you. We hope that your perspective will always be a healthy one.